Hello everyone. Once again, welcome to you all to this university essay discussions on pediatrics. So, today we are going to, in this video, we are going to discuss about the certain vitamins and their deficiency disorders. Let's start with the vitamins. That is, we have two types of vitamin. As we all know, that is fat soluble and water soluble vitamins. In fat soluble vitamins, they are vitamin A, D, E, K, and water soluble are the vitamin B complex and C vitamins. So then our main topic is vitamin A and their deficiency disorders. And a lot of the essay questions or short essay questions which are asked based on the vitamin A and vitamin A deficiency disorder. That is WHO classification of vitamin A deficiency is also asked, and also the hypervitaminosis A is also asked. And the clinical features that is also asked in the university exam. Let's start with the vitamin A. It is existed as all trans retinol, retinoic acid, and retinol in the human body. And the vitamin A, which refers to all trans retinol, the alcohol form of the vitamin. And the storage form of the vitamin A is called the retinyl palmitate, which is usually stored in the liver. And the aldehyde form of the vitamin A is called the retinal. That is, a major function of this retinal form is the vision. And physiologically, the most important derivative is the retinoic acid. Retinoic acid, which acts as a ligand for the specific nuclear transcription factors that regulate many genes that is involved in the fundamental biological activities of the cell. And our vitamin A, which is obtained from the plants as provitamin, carotenoids, alpha, beta, and gamma carotenes, and the cryptoxanthin. And the sources of the vitamin A are richest source are the oils extracted from the shark and cod liver, and carrots, dark green leafy vegetables, squash, oranges, and tomatoes, which are also good sources. Many infant foods and formula which are also fortified with the vitamin A. So these are the sources of the vitamin A. Then the recommended daily allowance for the vitamin E is 1,500 international unit. Then something about the absorption, metabolism, and storage of the vitamin A. The vitamin A and provitamin A, which are all fat soluble, that is, we already told that fat soluble vitamins are the A, D, E, K. So vitamin A is a fat soluble vitamin. Absorption depends upon the presence of adequate lipids and proteins in the meal. The beta carotene and other provitamins, which are converted into vitamin A with the help of dioxygenase, which is esterified into retinyl palmitate and which is stored in the liver. And from the liver, this retinal palmitate, this form of the vitamin A, which is released to circulation as retinol, and it binds with the transport protein called retinal binding protein, and therefore it is a protein. Hence, deficiency, which happens in the case of protein energy malnutrition, that is because of the protein deficiency. There is also occurs that is also leads to the deficiency of the vitamin A because of the lack of the retinal binding protein. Okay. So that is all about the absorption, metabolism, and storage for the vitamin A. Then about the functions of the vitamin A. The vitamin A, it is usually a function is for the vision. That is a non-genomic role mediated by the retinal, that is the aldehyde form of the vitamin A. And the retina has two photoreceptor systems, that is rods, rhodopsin, and cones, iodopsin. The vitamin A, which act as prosthetic group on both visual proteins. And the rhodopsin is for dark and light adaptation, and iodopsin is for the color vision. Uh, the metabolism of the vitamin A for the vision is shown in this flow chart. There is levels is retinalis by the because of the light, it converted into all transretinal by the photoisomerization, and this all transretinal is converted to electrical signals to brain, and this convert back to Leven's retinal. That is the metabolism of the vitamin A for the vision. That is as a short. And other functions of the vitamin A, which include genomic functions mediated by the retinoic acid. Then we have important for the cell, that is, and this it is also important for the cell division, cell death, and cell differentiation. Important for the integrity of the epithelium, for the reproduction, growth, embryonic and fetal development, and bone development. And also, the vitamin A is important for the immunity and host defense. So these are the major functions of the vitamin A. That is, major functions for the retinal as in the vision. Then we have the genomic functions, important for the cell division, cell death, and cell differentiation, and important for the integrity of the epithelium, for the reproduction, growth, embryonic and fetal development, and bone development, and also important for the immunity and host defense. So the vitamin A deficiency leads to impairment of all these functions. So then the main topic of today is vitamin A deficiency. So first about the uh, incidence. It is common in the developing countries. The preschool children which suffers from the blindness every year due to vitamin A deficiency. The predisposing factors of the vitamin A deficiency, as we already told, that protein energy malnutrition because of the lack of the protein, the transport protein for the vitamin A. It also leads to vitamin A deficiency and also the malabsorption. If we consume adequate amount of the vitamin A, but if there is any malabsorption, that also leads to the vitamin A deficiency, and consumption of the folic rice with the little fruits or vegetables predisposed to deficiency. Then morbidity and mortality, which are more due to increased vulnerability to infections, especially measles. Earliest manifestation is defective dark adaptation resulting in the night blindness. So, earliest manifestation of vitamin A deficiency is the defective dark adaptation resulting in the night blindness. And the next topic is the WHO classification of vitamin A deficiency. This is most commonly asked in our university exams most oftenly. And that is WHO classification of vitamin A deficiencies. The X1A conjunctival xerosis, that is X1B beta spots, that is a plagues of conjunctival keratinization. As shown in this picture, there is a plague, a white plaque on the conjunctiva, that is X1B beta spot, and X2 is the corneal xerosis, and X3A is the corneal ulceration, that is occupying less than one third of the cornea, and X3B is corneal ulceration, that is occupying greater than one third of the cornea. And the XN is night blindness, XF is the fundal changes, and XS is the corneal scarring. So these are all about the WHO classification of vitamin A deficiency. Okay, this is more commonly asked in our university exams. So we should learn that WHO classification for the vitamin A deficiency. Then other features of deficiency are the diarrhea, respiratory infections and bronchial constriction, hyperkeratosis, because we all know that one of the major function of the vitamin A is the maintains the integrity of the epithelium, so it will result in the hyperkeratosis, dry, scaly, hyperkeratotic patches on the arms, legs, shoulders, and buttocks. The squamous metaplasm of the retinal pelvis, ureters, vaginal epithelium, and pancreatic and salivary ducts leading to infection. Then the pyuria, hematuria, infertility, and metaplastic bonds, which also results due to the deficiency of the vitamin A. So these are all the features of the vitamin A deficiency. The major deficiency symptom is or the major deficiency feature is the vision related. That is the WHO classification of the WHO classification of the vitamin A deficiency. And others are the diarrhea and the respiratory infections and bronchial constriction, etc. Then hyperkeratosis, etc. Then how will you diagnose a case of vitamin A deficiency? It is mainly by the clinical signs of deficiency, and then we have to look for the serum retinal levels. Then we have to go for dark adaptometry. In the early deficiency, ability of the pupil to construct under illumination is impaired. By flashing a light at one pupil and covering another, degree of impairment of the pupil reflex is estimated. The staining of the eye with rose Bengal dye, it's also help for the diagnosis of the vitamin A. Then we go into the treatment. If a patient is diagnosed with vitamin A deficiency, we have to treat them. That is, we have to treat with the three doses. That is, immediately we have to give, if the patient is less than 1 year old, we have to give 1 lakh international unit of the vitamin A orally. And if the patient is greater than 1 years of age, we have to give 2 lakhs international units. So, like three doses, that is immediately, and the next day, and after 2 to 4 weeks, we have to give orally vitamin A. And in the case of severe protein energy malnutrition, repeated monthly till protein energy malnutrition subsides, we have to give the vitamin A. That is, in the doses is same. That is less than 1 year of age, we have to give the 1 lakh international unit. And if the patient have the greater than 1 years of age, we have to give the 2 lakhs international unit. Then, how will you prevent the vitamin A deficiency? Okay, the vitamin A prophylaxis program, that is National Program for the Prevention of the Blindness, was started in the 1970, and in the 2006 was expanded to include 6 to 59 months old children. The WHO recommends children between the 9 months and 5 years given 9 mega doses of vitamin A concentrate at 6 months interval in areas where the vitamin A deficiency induced blindness is a major public health problem. Okay, so in at the 6 to 11 months of age, we have to give 1 lakh international unit once with measles vaccine, and at 12 to 59 months of age, we have to give the doses 2 lakhs international unit once every 6 months up to 59 months. Currently in India, with the declining incidence of the vitamin A deficiency, the supplementation is given only to children less than 3 years of age. Hence, only two doses are given, once at 9 months with the MR vaccine and second at 50 to 80 months with the DPT booster. The children with the measles and malnutrition should receive the vitamin A prophylaxis 1 lakh if less than 1 year and 2 lakh if less than greater than 1 year. So that is all about the vitamin A deficiency. Then we have to move into the hypervitaminosis A. That is also asked as a short note on our in our university exam. Hypervitaminosis A is rare form of the disease, and it is never happens from the diet. It is due to the excess supplementation in the children, attractive capsule, or to the mother during pregnancy can cause this condition. In adolescents, during the acne treatment, we usually use the retinol. So because of that, there will be hypervitaminosis A. Clinically, it is present as well with the fatigue, malaise, anorexia, vomiting, and diplopia. That is diplopia related to increased CSF pressure. That is condition is called the pseudotumor cerebri. And there are also the bone pain, dermatitis, hepatomegaly, hypercalcemia, and fetal abnormalities is there. So that is all about the vitamin A deficiency. Then we moving on to the um, vitamin C deficiency, that is ascorbic acid. The short note on this curve is usually a university question. So we should learn about the vitamin C clearly. Okay, so the functions of the vitamins. Vitamin C is also called ascorbic acid. The functions of the vitamins C is importance for the cell synthesis of the collagen, and that is involved in the neurotransmitter metabolism. Important antioxidant in the aqueous media of the body, enhances non-heme iron absorption. So these are the functions of the vitamin C. That is, it is important for the synthesis of the collagen, and it is involved in the neurotransmitter metabolism. It is important antioxidant, and it is enhances the non-heme ion absorption. And the sources of the vitamin C are citrus fruits, fruit juices, pepper berries, melons, tomatoes, cauliflower, and green vegetables. Amla is considered as a richer source of the vitamin C, destroyed by the prolonged storage, overcooking. That is, vitamin C storage is destroyed by the prolonged storage, overcooking, and processing of the foods. And the recommended daily allowance is 15 to 40 milligram per day. And the deficiency of the vitamin C is known as scurvy. That is most commonly asked in our university exam about the scurvy. Now it is less common, usually found with the other deficiencies, and occurs with the top-fed infants, that is pasteurized or boiled animal milk, total parental nutrition. This usually happens in this group of the children's. And the clinical features of the scurvy are irritability, loss of appetite, and low-grade fever, the pseudo-paralysis and frog-leg position due to the tenderness and swelling in the legs, especially knees. The subperiosteal hemorrhage in the lower limb. Because of the impairment in the production of the collagen, there will be the bleeding happens. So there will be subperiosteal hemorrhage in the lower limb bones, especially. And then we have the another feature is the scorbutic rosary, sharp, angulated, and tender. Uh, uh, um, uh, Tender scorbutic rosary will be produced. Then we have gum changes like bluish, purple, and spongy swellings of mucous membranes. And then we have the anemia. Because of the decreased absorption of the non-heme iron. And then we have the PTK, because of this hemorrhage, we have the PTK, purpura, ecchymosis, and epistaxis. And poor wound healing, hyperkeratosis of the hair follicles, and muscle weakness will be there. So these are all due to this impairment of the major functions of the vitamin C, like the collagen synthesis and decrease the absorption of the non-heme iron, like etc. So if the deficiency of this happens, that will result in the opposite of this function. That is, it will result in the hemorrhage, and it will result in the weakness, muscle weakness, and results in the poor wound healing, and it will result in the purpura, ecchymosis, epistaxis, gum changes, and also superiorly hemorrhage like that. So this is the diagrammatic presentation. This picture. This is the picture we showing the diagrammatic presentation of scurvy. In this picture, there will be subperiosteal because of this collagen abnormality or the decreased synthesis of the collagen. There will be subperiosteal hemorrhage in the process of bone formation, giving bony and club-like appearance. Then we have the white line of Frankel often projects laterally as a spur. This is the white line of Frankel that is often projects laterally as a spur. Then we have the triangular zone of the rare fraction, that is corner sign. Then we have the pencil marking of the cortex or the epiphysis, that is Wimberger's sign. Then we have that is the epiphysis. This is the ring-like epiphysis that is called the Wimberger's sign. These are the diagrammatic presentations. We have white line of Frankel, then we have the pencil marking of the cortex of epiphysis, that is Wimberger sign, then we have the triangular sort of rarefaction, then we have the subperiosteal hemorrhage. These are the diagrammatic presentation of scurvy. Then we have the how will you diagnose the scurvy? That is usually by the X-ray at the distal end of the long bones, especially knees. We have a ground glass appearance of the shaft, pencil thin cortex. Then we have defect in the osteoid formation, but provisional calcification is normal. Contrary to rickets, in the rickets there will be the provisional calcification zone is lost, but in this scurvy there will be the provisional calcification zone is normal. So calcium deposition continued undisturbed, but delay in the conversion of the calcified cartilage into bone, which results in the white line of Frankel, and that is an irregular thickened white line at a metaphysis. The white line of Frankel is a irregular thickened white line at metaphysis, provisional zone of the calcified. That is called the provisional zone of the calcified cartilage. Then we have the zone of the rarefaction under the white. This under the white line of Frankel, we have this triangular zone of the rarefaction. And that is called the tremor field zone. That is under the line of the white line of triangle, there will be triangular zone or rarefaction. That is called the tremor field zone, which occurs later, represents area of debris of broken down bone trabeculation and connective tissue. Then we have the Pelton's spur. That is prolongation of the white line at the cortical end is called the prolongation of the white line at the cortical end is called the Pelton's spur. Then we have the corner sign. That is calcification on the sides beyond metaphysis and broken strips of bones at the corner. Then we have the biochemical tests which are not very useful. Usually by the X-ray, we can find out the scurvy. That is by the important features like ground glass appearance of the shaft, ground glass appearance of the shaft. Then we have the pencil thin cortex, that is pencil thin cortex. Then we have the white line of Frankel because of the defect in the osteoid formation, but the zone of calcification is normal. And then we have the zone of rarefaction or the white line, that is called the tremor field zone. Then we have the Pelton's spur, that is because that is the prolongation of the white line at the cortical end. Then we have the corner sign, and also we by some biochemical test we can diagnose the scurvy. Then treatment is because all these features are because of the vitamin C deficiency. So we have to supplement the vitamin C. 100 to 100 milligram per day results in the magical improvement, and it can given as oral or parenteral, and it is continuous for the 3 months. So that is all about the vitamin C deficiency, that is scurvy. It is a most commonly asked university question. Okay. Then about the vitamin K. The vitamin K, it is, as already told, that it is a fat-soluble vitamin function which increases concentration of the factors. That is factor 2, 7, 9, and 10, and other vitamin K dependent factors which are factors S and C. These are all the clotting factors. So it deficiency leads to, because of deficiency of the clotting factors or the decreased concentration of these clotting factors, which leads to hemorrhagic disease of the newborn. That is the most important question. That is hemorrhagic disease of the newborn is due to the vitamin K deficiency. And the hemorrhagic disease of the newborn is common in exclusively breastfed infants, as concentration of the vitamin K in the breast milk is very low. That is 50 microgram percentage versus, but in the cow's milk it is 60 microgram percentage. So because of the less concentration of vitamin K in the breast milk, in a exclusively breastfed infant, there will be the chance for the development of the hemorrhagic disease of the newborn. Hence, it is mandatory to give the vitamin K at a dose of this dose is very important. That is 0.5 to 1 milligram at birth to all the babies. So after birth, we have to give the vitamin K 0.5 milligram at birth for all the babies to prevent the hemorrhagic disease or newborn, because we already know that our breast milk is very less have very less vitamin K. So all the babies should be receive vitamin K at a dose of the 0.1 to 1, 0.5 to 1 milligram at birth. And the hemorrhagic disease of newborn is manifest as bleeding tendency in the newborn and infants. And the treatment is vitamin K 2 to 5 milligram For the prevention, it is 0.5 to 1 milligram, but for the treatment, it is vitamin K 2 to 5 milligram, vitamin K 2 to 5 milligram. And because of the replacement of the lost blood, we have to give the blood transfusion and fresh frozen plasma. In the older children, vitamin K deficiency which can occur due to the prolonged antibiotic treatment due to the elimination of the intestinal flora, because some of the vitamin K is also produced by the intestinal flora. So, in the case of the prolonged antibiotic treatment, because of the destruction of the intestinal flora, there will be lack of the vitamin K deficiency, and the fat malabsorption like biliary obstruction, cystic fibrosis, short bowel syndrome, and celiac disease, which also results in the vitamin K deficiency. And the vitamin K needs to be supplemented in these conditions like fat malabsorption and prolonged antibiotic treatment. We have to give the vitamin K supplements. Okay. So that's also about the vitamin K deficiency. Uh,